do this, and so I want all you guys to know how to do this, and so y'all can start lecturing in your states. And so if anybody calls and has a question about it, you're well versed. So again, if you had, and of course I'm always available if you have a question or concern, reach out. I'm happy to answer and help you guys in any way. So let's definitely get started, because this is definitely a whole lot. In the beginning, I'm going to kind of fly through, because it kind of touches on submitting patient conditions, diabetes, hypertension, high blood pressure. Just so you know, I said on the patient record report, it gives the opportunity for you to check that, if that's the way you want to track that in your practice. But it definitely really benefits. It not only increases your reimbursement, but VSP actually does a recall program when you do this. Now, when you're submitting these patient conditions, this is how it looks when your staff goes to submit the claim on ifinity.com. This is what it looks like. And so it's that easy. They literally just click the condition. So it's super easy. But that one click combined with the CPT2 code actually gets $5 extra for every exam. So it's big. You definitely want to do that. And we're all about increasing our reimbursement. A simple click can definitely do that for you. And so, I mean, it doesn't change how you bill necessarily, for like the diagnosis code. It can still certainly be a refractive diagnosis code. And then in the secondary position, you can put that patient's diabetic. So again, just because you're clicking diabetes doesn't mean that it's now a medical claim. It can be a refractive routine claim. I said, you're just telling VSP that this patient has diabetes. Used to, you could click just diabetes and get your $5 reimbursement. Well, that's no longer the case. It has to have the CPT2 code that identifies the treatment level that you performed in your practice for that diabetic patient, meaning you did photos, or you did a retinal screening, or you dilated the patient and you communicated to their PCP. So again, that part has to be attached to not just clicking the condition, but also submitting the CPT2 code. They also have these sticky notes available if you'd like in your practice to flag that, so that whoever's submitting your claims is sure to click the correct code or the correct condition so that you get reimbursed appropriately. And so, again, $5 for the diabetic patient, $2 for the high cholesterol or hypertensive patient. And so, it comes up on the line item as an E5 here. You'll see the patient condition has diabetes or diabetic retinopathy, and $5 additional payment is how that looks on your explanation of payment when it comes in. So it definitely increases your revenue, and on your VSP value programs and your data, your practice reports, it'll show you, whether you've gotten reimbursed like you should and what money you're leaving on the table. So you definitely want to evaluate and make sure that you're being reimbursed like you should for reporting those conditions. What's really important is, again, if you'll flag your patient's diabetic, VSP can keep up with, if it's been more than 14 months and since that patient had an authorization activated again, they will send a recall on your behalf to that diabetic patient. They know how important it is to get those in, and it will list the date of the last exam, the last doctor they went to, their address and phone number. So VSP is sending your patient a recall for you, and it's no charge. So I think it's 1.2 million recalls went out last year on behalf of ODs, so they get those diabetic patients back in. So it's worth clicking these conditions, getting the higher payment, and again, making sure you're getting a backup recall system in addition to your own robust recall system. So the category 2 CPT codes are just reporting codes, and this is so important, guys. We play an incredible role on treating diabetic patients. I mean, a lot of times we're the first identifiers that this patient's diabetic because they had a big shift in prescription. Or of course, we look at the back of the eye and there's dot blot hemes, and this patient doesn't even know they're diabetic. So we play such a critical role, but payers like Blue Cross Blue Shield and Qual Choice and United Healthcare, I said, they don't know that we play such a critical role unless we tell them. And the only way they get their information is from CPT2 codes, these reporting codes, so their systems actually populate and process, what percentage of patients are getting care and the treatments and outcomes, again, based on the reports that they get through CPT2 codes. So if we're not submitting those, we're not going to be at the table talking to these payers and telling them how important the important job we are in participating with these patients with diabetes. So please, please, please attach the CPT2 code. It's really important, not just for reimbursement, but for our industry and the place that we hold with our payers. Okay, so let's jump in with essential medical eye care. So why? What happened? Well, VSP has no desire to play ball with Blue Cross Blue Shield or compete against United Healthcare. They do not want to be in the medical field, in the medical insurance field. Why this came about was that there are multiple areas in the United States where ODs cannot get on medical panels for whatever reason. And so because so much of ODs of the VSP board is actually private practicing ODs, they came to VSP and said, hey, we need a way to where we can keep our patients and not have to refer them to somebody they don't even know to grant them the care that we are more than well trained to provide. But we can't right now because we can't take their medical insurance. We can't get on the panel. And so as a result, VSP sit down and devised an incredible eye health plan, an eye medical plan. It is really good. It's very robust. There's so much treatment options in this. So it allows patients or VSP doctors that are not on medical panels to actually provide that medical care. And it is really a good plan. So if you're not familiar with essential medical eye care, believe me, many of your patients are. VSP does a really good job educating their members to make sure they're aware that they don't have just the routine vision policy. They don't have just that coverage. They also actually have a medical coverage for their eye care built into that policy. And so they really try hard to educate their patients or their members and your patients. This isn't a unicorn. This isn't going to be something that you don't see, or it's going to be something you see here and there. You're going to see it all day, every day. As of March of 2025, 63 million members actually has essential medical eye care at this point. Okay, now it comes standard with VSP's signature choice and advantage plans. Now the client can opt out, meaning the client FedEx, Boeing, any of the big companies that actually purchase the vision plan, they can opt out and decide they don't want essential medical eye care built into the plan, the signature choice and advantage. Most of them keep it because they know that a very functional, very healthy employee is a very productive employee. So they usually keep these medical plans for their employees because, again, it keeps them healthy and more productive. So you're going to see this again and again. So how do you know if your patient has essential medical eye care and what their benefits are? So if you've not seen this screen, it's okay. Your staff, when they pull up the eligibility and what your patient's benefits are for VSP, this is what comes up. So when they're pulling up the authorizations that they have to take VSP, this is what comes up, and you can see that there's multiple benefits showing up on this page. On the bottom left, VSP signature plan, additional pair on the top right. On the bottom right is essential medical eye care. So if this is coming up, it means that that patient has this eligibility. Now, yeah. So we have, in my practice, what we do is we get 3 authorizations at this point. So my staff is trained that we go ahead and get an authorization number for the exam only. And I usually do exam and contact lens exam. You just go ahead and click both and have one authorization number so that if my patient does a contact lens exam, we can use that authorization number just like we can if they do a glasses exam. So again, one authorization number is exam only. The second authorization number is material only. And then the third authorization, I go ahead and get the essential medical eye care authorization. And you just click authorize benefit and issue authorization. So this is easy for your staff to just go ahead and get it because my office, 99% of the time, a routine annual exam turns into medical most of the time because there's going to be something medical that I find. Now, unlike the signature plan or the well vision plans, I said the burden for your staff isn't increased by going ahead and getting this authorization number. This authorization number just falls off the table after 30 days. Your staff doesn't have to call VSP and reverse this authorization. It just, again, literally becomes inactive after 30 days. So it's easy for them to go ahead and activate it, but it's not a burden on them having to call back and actually reverse it. So definitely suggest that your staff goes ahead and gets all three of those authorization numbers for any of your well vision exam or your routine annual eye exam patients. So like in this example, you'll see that there's three authorization numbers. So the first one is for the signature well vision plan. You'll see on the date, it's October 1st and 23 in this example. That's one authorization number. And then, of course, the staff got an essential medical eye care on the same day, and it's a different authorization number because you can coordinate between these two. So you may need both of those authorization numbers on the same day. And I'll show you how later, but your staff needs to go ahead and get both of those authorization numbers for you from the get-go so they're ready to use and make things so smooth for your billing process. However, you can also get as many essential medical eye care authorization numbers as deemed medically appropriate. So in this case, you'll see a third authorization number at the bottom. So the reason being is that, let's say on 10/1 of 23, you saw this patient and they were a glaucoma suspect, and you needed to have them back on the next day to do a visual field OCT, PAC, gonio. Well, then you get a different authorization number for that day, and you'll see that patient for just diagnostic testing, and you'll submit those codes under that authorization number. You can get as many authorization numbers as deemed medically appropriate under the essential medical eye care. So if you have a patient that's a corneal ulcer patient and you need to see them 10 days in a row, well, then you get granted 10 authorization numbers. You just go in each day and get an authorization number. And like I said, of course, you bill that office visit to that authorization number for that day, and then you do it for the 9 subsequent days in the event that you need to see that patient. Again, whatever's deemed medically appropriate, again, you're granted that many authorization numbers. So let's make sure that you understand, what does essential medical eye care actually cover and what does it do? If you'll imagine, it is like having a Blue Cross Blue Shield plan. It is medical. So it's going to cover any acute, chronic conditions. It's going to allow that patient to stay with you. You are well trained, you're experts, your patient trusts you, they know you. You're not going to have to refer them to somebody they do not know. It also is going to reduce their out-of-pocket costs because they're not having to go see you and they go to somebody else and pay that, copay and that supplement. So it keeps everything in-house and reduces their out-of-pocket costs. So they're likely to come back and get the care that they need, of course. It does not cover refraction. It doesn't cover any pharmaceuticals or any eyewear material. Remember, it's medical only. It is not going to cover anything routine vision care. So in that plan, remember I said it's a really robust, well-written plan. They did a good job with this. Your 9992 codes are covered under that, so you don't have to just bill 92 codes like you do with the Well Vision plan. Essential Medical Eye Care recognizes the 99 codes as well. And then all the diagnostic testing, there's like 85 CPT codes that are recognized for your diagnostic testing, from punctal plugs, corneal topos, OCT, visual field, gonio, just about anything that you're going to perform in your office, that CPT code is accepted by Essential Medical Eye Care. And so you can bill it just like you would to any medical payer. However, they really thought outside the box. So there's a couple of codes that isn't usually covered under your medical plans like United Healthcare or Blue Cross Blue Shield. This is one of them. So in this case, the 92499 code is for patients that come in and they have had a change in diabetic medication or had it added and it caused a shift in their prescription of at least a diopter. You want to document that it's due to a change in medication and that there's a diopter change in refraction, and those two events. Then I said you also have to have that there's some diabetic changes. So the diagnosis codes that are accepted for the 92499 code is has to be diabetic retinopathy of some sort. So there has to be some sign of dot blot or some type of retinopathy in order to get paid for this. So not only does it need to have a shift in prescription of at least a diopter, and that due to a change in medication or an addition of medication, but also there has to be some level of pathology in order to get reimbursed. But the good news is that they will pay you $45 to rerun those numbers when there's been a shift like that due to change in medication. And you can do that once a year, and you can get reimbursed for that. So how does this work? So essential medical eye care is always secondary to the patient's major medical. So if you are on the medical plan and the patient has major medical, essential medical eye care always takes the secondary position, always. Now, if you're not on the medical plan or the patient doesn't have major medical, well, then essential medical eye care takes the primary position and you'll just bill it directly. And so, of course, you won't have to coordinate those benefits. If it's in the secondary position, of course, you'll coordinate benefits between their major medical and essential medical eye care. We'll show you how. So, how do you get reimbursed for essential medical eye care? So we're assuming that essential medical eye care is primary. Okay, this is under this example. This is when it's primary. Either you're not on the plan, or there's no major medical period. So essential medical eye care becomes their primary. So when you're billing the 9299 codes, you get reimbursed the same thing you do under your signature plan payable amounts. And you'll find that out on your assigned fee report. It is really important that you know what your contracted assigned fee report fees are with VSP. And here's why. You may get paid more for a 99213 than you do a 92012. Well, you need to know that, because obviously as long as you meet the documentation requirements, you're going to want to bill whichever reimburses highest. Okay. And again, this only applies when essential medical eye care is primary. So we'll show you how to figure out your assigned fee report and how to get to it here in just a second. Okay. Now, any additional covered services, meaning other diagnostic testing, your topos, your PACs, gonio, any of the diagnostic testing, you're going to get paid just about the same thing that you do for Medicare and Medicaid, okay, for CMS services. And so it's pretty darn close to that. So let's talk about how to view what your payables are under the signature plan. So that's what you're going to get reimbursed for the exam codes for essential medical eye care, again, when it's primary. So you're going to go to vsponline.affinity.com and you will click links and tools. So you'll go to, this is affinity.com, and you'll click VSP Online, and then you'll go to quick links and tools. You'll click update practice information, and underneath that there's view fees. That when you click view fees, it takes you to your assigned fee report that is specific for your practice. So when your staff logs into affinity.com, they have an ID and password that's specific for your practice. So that is going to take you to your specific practice's assigned fee report. That's going to show you exactly what your contracted fee reimbursement fees are from VSP. Under the signature plan is what you get reimbursed for essential medical eye care for the exams when it's primary. So with that statement, let's do some examples. So in this case, you have of course, your regular well vision exam patient. New patient comes in, brand new patient comes in, says, I just need an eye exam. Of course, all they know to tell you is they have blurred vision. Okay. Now, in my practice, chief complaint is always one of the last things we fill in, because so often a patient's only going to tell you the verbiage that they know. They don't know what's going on. But then during your findings, you can ask more questions and find out that there's more to that chief complaint than just blurred vision. So in this example, the patient says, gosh, I've got blurred vision. Well, of course, through the exam, you find that, the patient's not just myopic. Well, they've got some corneal edema. They've got allergic conjunctivitis, and they've got some corneal dystrophy. Well, now this becomes a medical, because we need to treat the corneal edema, not just the myopia. So now we need to make sure that we bill accordingly for our expertise and our treatment methods. And so in this case, the patient has a medical, let's say Blue Cross Blue Shield. So they have major medical as their primary. They do not have essential medical eye care on their plan. They just have a well vision plan. In this example, it's a VSP signature plan. So we have Blue Cross Blue Shield and VSP signature in this plan, in this example only. You can actually coordinate benefits with the well vision plans and the major medical. VSP allows that. Let me show you how. So let's do some billing examples here. So for the same patient, I said, you're going to want to know that when the regular VSP signature, choice, or advantage plans are in the secondary position, they will actually reimburse for the exam under signature and VSP choice $66. Okay, so and that's across the nation. That's going to be the same for every state. It's the same always. You're going to have $66 to play with when the Well Vision plan is in the secondary position, if they have signature and choice. If they have advantage, then they have $50 to play with. Okay, so remember that. So let's show you the billing breakdown. So same again, new patient, regular exam, come in for my 92004, 92015. My usual and customary is $240, $200 for the exam, $40 for the refraction. So in this case, it's important to know that, again, Blue Cross Blue Shield is my insurance I'm using for this example. Let's say Blue Cross Blue Shield, I've contracted with them to accept $150 as payment in full for that 92004. It is vitally important that you know what your allowed amounts are, because you signed a contract to be on that panel to accept for 92004 to accept nothing more than $150 as payment in full. Okay, you can't collect any more than that. Now, for the refraction, because it's not covered, well, then you can collect your full usual and customary. But for the 92004, because that is a covered procedure through Blue Cross Blue Shield and payable, then you agreed that you're only going to collect $150. Okay, so in this example, the other insurance, meaning Blue Cross Blue Shield, paid $120, even though I have $150 that's the allowed amount. The difference is $30. The patient had a $30 copay. But with the $30 copay and the $120 that they pay, there's the allowed amount of $150. So at this point, though, they're not going to pay anything for the refraction, of course, because that's not covered. And so it leaves the patient out-of-pocket cost the full $40 for the refraction. So in full, if we leave it like this, the patient's going to have a $70 copay. And I don't know if it's just an Arkansas thing or what, but I don't know about y'all, my patients will be ticked, will be very angry if they, ended up with a $70 copay. But luckily, though, because we know how to coordinate benefits with VSP, we're going to use their other benefits. So remember, under the signature plan, they have $66 to play with in the secondary position to coordinate with the Blue Cross Blue Shield. So we're going to take 30 of that 66 to eat up their copay for the 92004. And that leaves $34 that you're going to put towards the refraction. So that $40 refraction now is minus the 36 from your 66 allowed, leaves the patient as a $4 copay. I don't know about y'all, my patient's much happier with a $4 copay versus a $70 copay. The biggest thing, though, is that look at your bottom line reimbursement. So for the exam and refraction, you collected $190, which is substantially more than if you had just billed VSP as primary and took the routine vision payment. So now we've increased our reimbursement substantially. So again, $190 for the doctor, $4 out of pocket for the patient. So everybody's really happy. And again, remember, that is just when the patient had major medical and just regular signature plan, Well Vision plan, not essential medical eye care. So now let's go to the next step when the patient actually has all three. So same scenario, new patient comes in for a regular exam, and regular annual exam. They've got blurred vision, and again, you just determine they have allergies and corneal dystrophy and some corneal edema in addition to the myopia. So now this is medical. So the patient has Blue Cross Blue Shield, they have VSP signature plan, and essential medical eye care. So this patient has 3 vision insurance that you're going to want to know how to coordinate those benefits on their behalf, because it's their benefits. You want to be able to use them and help the patient utilize them to reduce their out-of-pocket cost. So let's show how this works, okay? So same thing. I said, of course, this is the billing breakdown, and we're going to do a 92004, 92015. And so my usual and customary is $240 for that. Again, allowed amount from Blue Cross Blue Shield is $150. And of course, they're not going to pay anything on the refraction. So same thing. They're going to pay $120 because the patient had a $30 copay. They're paying nothing on the refraction, and so the patient has $40. Again, $70 out of pocket at this point. but this time the patient has essential medical eye care. And so you're going to be able to use that reimbursement from essential medical eye care to coordinate those benefits. Now, you can only apply the benefits from essential medical eye care to the medical part of the exam. Remember, it's not going to pay anything on the refraction. Essential medical eye care is another medical plan for this patient, but it is going to eat up that full $30. Now, the way we got this, it's figured that whatever my reimbursement is for the signature plan for 92004 is how much I'd have to play with. Well, let's say in my case that $75 is what I get reimbursed for, and that's not a true quote. I'm just throwing that as an example. Well, you're not going to get the 75. You're only going to get what is the patient's out of pocket, which is in this case $30. Okay, so you're going to use the patient's essential medical eye care to take care of any remaining out of pocket costs for the exam, for the medical part of that exam for your 92004. Okay. If you collected any more than that, it violates your Blue Cross Blue Shield contract or United Healthcare, whatever is that primary medical, because remember, you can only collect up to $150 for a 92004 for that CPT code. That's what I've contracted with them to say I'll collect just $150. So essential medical eye care is only going to pay you what's out of pocket for the patient, okay? So the good news, though, is we didn't have to pull that 30 out of the VSP signature plan, because remember, you have $66 to play with when that's in the secondary position as well. So that whole 66 can now go to the refraction of 40. So now the patient has a zero copay altogether, because everything's going to be eaten up by essential medical eye care and the VSP signature plan. Again, your reimbursement's $190, your patient's out of pocket is zero. So it is amazing. Very happy patient, very happy doctor. Okay. Now, understand that, I mean, when copays apply, you only collect the copay for whatever plan you actually attach to a 9992 code. There are no copays for diagnostic testing, just the exam, okay? But in this case, if we had collected the essential medical eye care copay, because that's the one we applied to the 92004, well then, if let's say it was a $20 copay, well now I will have collected $170. You can't do that because it's over your 150 allowed amount that I agreed was my payment in full. So it would violate my contract. So this patient pays no copay, and they pay no copay from the primary because the essential medical eye care and VSP signature is going to pick all that up. So literally they pay nothing, and you make your $190. You want to make sure that that plan allows for coordination of benefit. And that's where you're going to want to make sure that that patient record report doesn't just go to your optician. That patient record report needs to go through every step of the journey with that patient, from the front desk to your tech, to your exam lane, to the optician, to the contact lens room. That needs to go everywhere, like I said, so that everybody knows what their benefits are. It's critical. Because if there's no coordination of benefits with that particular plan, then like I said, you can't use these benefits. Like I said, that plan won't allow it. So let's show you how to submit the claim with, this is an e-claim. And so no, in my practice, we bill the major medical as primary just through my practice management system, okay? Then I come to Eyefinity and I coordinate the benefits for the essential medical eye care and the well vision plan, okay? Now, there is something that my biller automatically knew and had forgot to tell me that I had found out just recently, that if you are going to bill anything besides just your regular 92004 and 92015, let's say you're going to bill a 92250, you're going to bill a photo with it, you know, and you have essential medical eye care, the authorization number that you start with, and you're going to put that in at the bottom where it says enter authorization number and the go button beside it. The authorization number you have to put in here has to be the essential medical eye care authorization. That authorization number is going to accept those diagnostic testing codes. The well vision authorization number will not accept those diagnostic codes, the CPT codes for like visual field OCTs, and it will reject the claim. So this has to start with the essential medical eye care authorization number in the beginning. Then you click go. Okay, so then it's going to take you to the next page. You'll simply put date of service, and then you need to tell VSP who's the primary medical that you're billing. Okay, so it tells them this is a coordination of benefits claim. And so you'll see there's several options: Medicare, Medicaid, TRICARE. The one highlighted in blue that says group health plan, any of your commercial plans falls under that group health plan. Okay, so United Healthcare, Qual Choice, all those fall under that group health plan, under that one. Okay, so then it's going to take you to the insured section. Okay, what's critical is on 11D, you want to tell them, yes, there's another health benefit. This tells VSP, again, this is a coordination of benefits claim. Okay, so that you've already billed primary medical to somebody else. And then it's the orange that's highlighted in orange, the box under it. This is where you'll put your well vision authorization number here if that patient has both essential medical eye care and well vision. Okay, now my understanding is when you put the essential medical eye care first, you may have an error message later that flags that the refraction's not covered. Click OK. Because you're putting the well vision authorization number here, it will go ahead and pick up the refraction code and that fee later. So just click OK and keep going. In the bottom here where it says other insured, the information VSP wants here is not the about the VSP insured. It's who owns the primary medical plan that you build. Okay, it may not be your patient, it may be their mom or dad or their spouse. So you're going to put the whoever owns the major medical plan that you build. You put their name, first name, last name, and 9A, the policy number of the major medical. Okay, and then the policy name and 9D. Okay, now the policy number, VSP doesn't really care about the policy number for the primary medical, but you can't leave anything blank in this claim if it has a red asterisk prior to the number. So if your staff just wants to put 1, 2, 3, 4, 5, they can. So whatever makes it so they don't forget in your practice, if you want to put the policy number of the primary medical so it reminds them to put the first and last name of the person that owns the primary medical, certainly you can. But again, if you don't, you can just put 1, 2, 3, 4, 5 and it will still go through. But it can't leave it blank. So now it takes you to the services page. So whatever you bill as to your primary medical has to match the secondary. You cannot bill one thing to primary and something different to secondary. I said it will get rejected. Just like whatever you bill to Medicare, the same thing gets billed to the supplement. So same thing applies here. Nothing's different. And I know it's everything against that we know about VSP because we always want to bill routine vision codes, but you can't. If you build medical codes, and of course you had to major medical, you have to turn around and build medical codes to VSP because VSP's in the secondary position. That's okay. That's how this works. That's what they're doing and why. Okay. In this example, I build again medical diagnosis codes in the A and B spot, and then in the C spot I did the refractive code. You have to go ahead and include a refractive code in order to get paid for your 92015. Okay, now this is what I billed to Blue Cross Blue Shield, knowing that I'm not going to get paid for that 9205. It's going to get rejected, but that's okay. Whatever I bill to primary, I have to bill to secondary, but if I didn't bill it to primary, I can't bill it to secondary. So everything has to match. So you're going to want to go ahead and bill to primary medical your 92004 and your 92015, knowing it's going to, the 92015 is going to get rejected. But then you can carry it over here to VSP and again, bill it exactly the same way so that you get reimbursed for your 92015 as well. Still same thing. You can't just put a 92015 in Affinity and get reimbursed. It has to have the 92004 with the 92015 listed. Okay, so it has to match exactly what you billed the primary medical. So again, you want to be sure and have the diagnosis codes match exactly for what you have for your procedure code. So in the 92004, I have the A and B diagnosis pointers attached under 24E. I have A and B because I have just telling them, hey, just the medical diagnosis codes get applied to that CPT code. And then underneath on the 92015, under 24E, under diagnosis, I have C. So I'm attaching just the refractive diagnosis code to the 92015 is how that works, okay? Once you've done that, then you're going to tell them how did the other insurance pay you or not, okay? So you'll see this highlighted in the orange box on the bottom right. In the first column to the left, it says other insurance allowed. So you remember Blue Cross Blue Shield in my example for 92004 allows $150. It didn't allow anything for the 92015 because refraction's not covered. Then in the second column, it says other insurance paid. Well, they paid $120 and they didn't pay anything for the refractions. They paid $120 for the 92004, nothing for the refraction. Well, what was the patient's out of pocket? Of course, for the 92004, it was $30 copay. And of course, the $40 full amount for the refraction is the patient's responsibility. Because remember, they had $70 out of pocket before we coordinated benefits. So we're telling VSP the patient right now owes $70 without VSP paying anything. So that's what you're submitting here so they know what they need to pay on their side. In the event that the insurance pays zero, so in the column where it says other insurance paid, if there's a zero amount there, you have to tell VSP why. So there's a drop-down box on the right-hand side at the bottom. You'll see in this example, for 92015, of course, that's just not covered. So that would be what you selected. But you have other options, deductible, timely filing. So if there's a reason why the primary medical didn't pay, you have to tell them why. Now, if there's any payment at all from the other insurance, you don't have to drop down. But if there's a zero payment in that other insurance paid column, you have to click why, or that claim gets rejected. Okay, so I know that's a whole lot, and there's a lot, always questions with that, but there are great resources exactly how to do this step by step. I know that attached with this that you got, we attached exactly a step-by-step handout on how to submit claims electronically in coordinating benefits, but that's available in the manual. So all you have to do is go to ifinity.com, click on VSP Online, and on the left-hand side, you'll see all these options. You're going to click on manuals, and there's lots of options in the manuals. There's a whole section on coordination of benefits, okay? So like I said, if your staff likes to have something printed out and to go through and read it, in writing, that's a great option for them to go to. Some staff, however, doesn't do well with that. They do much better with online training and those tutorials that are online. Well, VSP has done a good job with that too. So same thing, you just go to ifinity.com, log in, VSP Online is what you click. And then same thing, you have these options on the left-hand side. Instead of clicking manuals, you're going to click training and support and then online training. So there's several options for online training, but for our example, we want to click submit claim because that's going to teach your staff how to submit claims and coordinate benefits. When you click that, it takes you to these options. There's lots of training modules here. And what I love is that they're little snippets of information. So like the top one's only 3 minutes, the second one's only 5 minutes, so that your staff can, between patients, watch that video. And if they didn't get it or quite understand it, they can go back and watch it again, and it's not a burden. It's not like you told them like this, we got to sit down for an hour and go through everything and try to absorb everything all at once. They can literally learn it in bites and pieces. So I like how they've done that. So it's easier for them. If they need to watch something over again, they can, and it's not a burden. So let's move on to retinal screening. So understand, I'm going to fly through this part every once in a while, and this is a unicorn. You're not going to hardly ever see this, but the reason I like this example is why it's so critically important that you know your patient's benefits. So, and you can utilize them for yourself and that patient. So there are a few well-vision plans, signature, choice, advantage plans that has the retinal screening built into it, okay? So you're going to want to know that. So literally their retinal screenings are paid in full for a few plans. So again, that patient record report is going to be vital because your staff's going to want to make sure that they're looking to see for your techs that do your retinal screenings. They're going to want to be trained to look at this sheet every time. So anybody that comes in with a routine retinal screening covered in full, it's a given they do retinal screenings because it's that patient's benefits. They should be doing that for the patient, and then you get the reimbursement for it. Okay, so the billing on that, you're not going to click anything because that covered retinal screening doesn't require any pathology. Again, it's for anybody that has that plan that has those retinal screenings covered in full. There's no requirement of any pathology, so you'll click none of these if they don't have anything, and then it's still just your refractive code because this is under their well vision plan that it's covered. And then the code that you want to use, the procedure code, is 92250 with the 52 modifier. The 52 modifier tells VSP that this is just a screening. There's no pathology. Okay, so under that, then you actually get reimbursed $39 for that. Okay, now let's change gears just a little bit to see something that something that's a screening you're going to see all the time. So if your patient has essential medical eye care and they're diabetic, immediately they get a screening. It's covered every single time. No pathology is required. It's a screening. So again, you want to have your techs trained to check for that patient record report to see if they have essential medical eye care. And if you know that patient's diabetic, then they immediately get those photos. Okay. So I don't know about you guys, but in Arkansas, we like our the potatoes and we like our biscuits and gravy. So I have a pile of diabetic patients. So I see this all day, every day, because so many people have VSP and essential medical eye care, and of course diabetes. So we do this a lot. You're going to want to make sure you flag this so the patient gets what they deserve and you get the reimbursement for taking that photo. So in this case, the CPT code's still the same. It's the 92250, which is your fundus photo, but with the 52 modifier saying there's no pathology. However, with essential medical eye care, the diagnosis code's different. Remember the one before where it's attached to your well vision plan as just a covered and full routine, it was just your routine diagnosis code. Well, with essential medical eye care, they don't accept routine diagnosis codes. It's a medical plan. So in this case, when it's a screening for diabetic patients that has essential medical eye care, in the primary diagnosis position, they want Z13.5 and then what type of diabetes they have in the secondary diagnostic position. Okay, so let me kind of show you. Remember that patient record report, it's going to show your patients, your staff, that they have essential medical eye care. Okay, they got to know this. So that needs to move every time with every patient. So let me show you how this is billed. So in this example, and this slide's a little busy, but it's important for us to set it up this way. This actually shows you two entirely separate claims. Okay, there is one claim on the left-hand side that we're going to bill to Well Vision Signature Plan. Okay, there is a totally different claim that is billed on the right-hand side from Essential Medical Eye Care. Okay, so two totally different claims. So don't let this confuse you. Okay, you're going to click for your services. Yep, that patient has diabetes. Okay, so let's focus on just the left-hand side with the Well Vision side right now. So you're going to do just the refractive code is primary, okay? And then your diabetic code is secondary. So this is how we bill Essential Medical Eye Care for that retinal screening and on a day that we do a regular full comprehensive exam when there was no pathology, okay? So again, this is assuming everything's primary and there's no primary medical, okay? This is when you're billing VSP, Well Vision primary, and you're billing Essential Medical Eye Care as primary. So in this example, you're going to do a routine code in the primary position. Now, when you go to bill the Essential Medical Eye Care, remember, you're going to do those Z codes, but I'll come back to that. We're going to focus on just the left-hand side to show you how to bill one claim and then the other one. So you're going to do just the Well Vision plan on this side. So you're going to bill your 92004 and your 92015 with the refractive code to your Well Vision authorization. So your 92004, 92015 with just a refractive diagnosis code under your signature plan authorization. So when you open and start your claim, you're going to put in that signature plan authorization and click go. But then you're only billing your exam code. So it's going to accept that because your exam codes, your 92004, 92015, are recognized by that signature plan authorization number. So this will go through. You're going to click because that patient's diabetic. You need to click that to get your extra $5 remember, you're going to also attach your CPT-2 code for diabetes. That's required. Both of those are required to get your reimbursement, your extra $5 reimbursement. And then you submit this claim. Then you start over with a whole different claim, and then in that claim, you're going to put in first the essential medical eye care authorization and click go. And then in that case, though, of course, you're going to click that they're diabetic, but then in the diagnosis here, you're going to do the Z13.5 and then the type of diabetes they are in the second position, and then you're going to bill your 92250 with a 52 modifier. That gets you reimbursed for your retinal screening. Okay, and it'll show you on your explanation of payment, your 92250 with a 52 modifier reimburses you $39. So let's say that retinal screening, though, shows some pathology. Well, then you're going to bill that under a 92250 like you're used to with no modifier, just like you would to Medicare or United Healthcare. So that code you're familiar with. Again, no modifier tells VSP there is pathology. It's just a regular fundus photo. It's not a screening. Okay, so when essential medical eye care and well vision's primary. Again, in this example, there is not a primary medical plan. Your well vision plan's primary and your essential medical eye care is primary. In this situation, you can actually bill routine exam to their signature plan, and then any medical diagnosis and diagnostic procedures to the essential medical eye care on the same day. I know this goes against anything we've been trained with Medicare and everything else, but remember, there's not a primary medical. This is when VSP plans are primary, and VSP plans can't coordinate together, and they recognize both plans as primary, and they've written the rules on this. So this is the only case that I know of at all where you can actually bill a routine eye exam and diagnostic testing on the same day. Okay, so let me show you how this works. Remember, in this slide, the left-hand side's one claim, the right-hand side's a totally different claim. So in this example, our diabetic patient now has diabetic retinopathy. So you're going to be sure and click those conditions appropriately. Now you're still, because you're billing this to Well Vision signature for this claim, and you started out that signature plan authorization, you're still going to do just a refractive diagnosis code, because this is just your Well Vision plan that you're submitting this claim to. Again, your 92004, 92015, that authorization recognizes those CPT codes, so it's okay. And you're going to do a CPT-2 code for your diabetes to get reimbursed your extra $5. And then click submit. And then you're going to create a whole nother claim where you're going to do your essential medical eye care authorization number, click go. In this situation, though, in the primary diagnosis spot, you're going to put that diabetic retinopathy code there. And then your diagnosis for your procedure code for your photos is the 92250. You get reimbursed about the same thing that you would for Medicare or Medicaid for the CMS for that fundus photo code. So, can you bill retinal screening for a patient with diabetes with essential medical eye care? Every day, all day. Yes, be sure and do that. Does essential medical eye care cover fundus photos and OCT? Yes, and lots more. About 85 additional services or diagnostic services are covered under essential medical eye care. Does essential medical eye care copay apply when the retinal screening? No. Remember, the copay only applies when you're using that insurance or that particular plan to apply to their exam, a 9992 code. If you're not billing a 9992 code, you do not collect the copay. So if you have a patient come back for visual field OCT and you don't attach a 99 code or a 92 code on that day, you do not collect a copay. So key takeaways, then hopefully you now know that 60 million plus have essential medical eye care. So you're going to see this again and again, and more than 85 covered procedures are in essential medical eye care. The medical copays applies to the medical exam only. no copay to visual field OCT, the additional diagnostic testing, and that patients with diabetes, even without pathology, they're covered under essential medical eye care for that screening, for that retinal screening. And then don't forget, of course, to include the CPT2 codes for your well vision plans for diabetes to get that reimbursement. And now, and I'm going to fly through this section. This is just applying when coordination of benefits between vision plan to vision plans, what I'm talking about here. Reminder, you got to make sure that that plan coordinates benefits, okay? So in the coordination of benefits section, there is a phenomenal flow chart that shows, and that's in your manuals. In that section, there's a phenomenal flow chart that shows your staff how to figure out who's primary and who's secondary. And so I have that printed out and laminated. Oh, I'm sorry. And I have that laminated so my staff can easily pull up and tell that, which plan's primary, so that if it's a, patient and their mother and father has a VSP plan, how do you figure out who's primary and who's secondary? Well, that flow chart tells your staff exactly that. So that crazy verbiage that's in the COB section on the patient record report that's so hard to understand, they don't have to notice any of that. They can literally pull that up and it's easy to tell who's primary and secondary. And then they go to eyefinity.com and there's a calculator that tells them exactly what to collect when you're merging and coordinating two vision plans. Even EMEC and VSP, you can actually coordinate those vision plans. So you'll click VSP online, and remember on the left-hand side here that you've got all these options. Calculators is the top one. It'll give you options for several calculators, but click the coordination of benefits calculator. Understand, this calculator only applies vision plan to vision plan. It will not work for medical plan to vision plan coordination. You have to use the numbers that we gave the examples for before. Again, this is only used for vision plan to vision plan. So this is what that calculator looks like. So you've got tabs up top where it's for glasses and contacts, and then you've got listed in the blue bar here primary plan, and on the right secondary plan. So your staff will just put in what your exam copay, your material copay, lens options, that information, whatever the primary plan was, you plug that in, and then on the secondary plan you'll actually have a drop down box that tells them you can put in signature or choice, whatever their plan was and what that copay is, and then you simply click calculate, and then it literally populates for your staff exactly what the patient out-of-pocket costs at the bottom right-hand side. In this case, the patient owes $7. So it does all the work for them, and it really cuts down on the complication of trying to coordinate benefits between vision plan to vision plan. Okay, guys, a little bit of time for Q&A. Like 7 minutes. So Q&A.
Hey, Annette.
Yes.
Dexter here. Again, a tremendous performance on your part. I really appreciate your expertise. You might remind everyone that the total notes, all these pages are available, and I encourage everyone to download them and print them out because it just makes it so much easier. And I think there's some enhancements coming to that, I heard yesterday.
Yes, like I said, so it should be attached to your invitation. At the bottom, there is several downloadable reference materials. And so like the handout from my PowerPoint, I said is in there. And so it gives my entire PowerPoint here is there. And then the step-by-step guide for how to submit the coordination of benefits online on the eyefinity.com website on how to coordinate that. So there's multiple handouts, and you're right, there's some enhancements coming out that makes this so much easier so that you know exactly how to do it in your practice, but more importantly, you also know how to teach your colleagues and your ODs in your state so they know how to do this as well. Great point, Dr. Dexter. Thank you.
The other thing is for those of us that are using EPM, I encourage all of you to get on the complaint list and suggest that they improve the EPM so that we can do the EMEC, the DEC plus, etc., and collect all the information in EPM. It's going to take a little bit of changes in programming if we can get the programmers on board, because they're resisting this. And it's been 2 years that I've been pounding the table, and I'm not getting very far. So I need all the ambassadors to get on board with me and tell our programmers, let's make this compatible with that great presentation you just did.
And you're right, and that is indeed a challenge. One thing that reminded me about is that you can actually, what in my practice, what we do is we bill the major medical through my practice management system, and then the same day we're going to Affinity and actually coordinating the benefits with VSP same day. VSP does not require your EOB from your primary medical for you to turn around. If you know your amounts, if you know your allowed amounts, and you know what patient out of pocket is going to be, you can go ahead and plug those in and go ahead and bill the secondary and tertiary through VSP, because the reason we do that is there's nothing in your practice management system that's going to flag VSP as secondary. It is only identified as primary because it's a vision plan. So to my knowledge, there's not a practice management system that's going to flag VSP as secondary for you. So then your staff is burdened with having to wait. If you want to wait for that primary EOB to come in and then go to eClaim and plug all the numbers in, you can, but you've got to have a way and a system in your office to make sure to remember to do that. And again, because your system's not going to flag VSP as secondary in your claims management part of your practice management system. So thank you, Dr. Dexter. Go ahead.
You have Dr. Fontenot next. Dr. Webb.
I just have a quick question. I'm pretty sure I know the answer to it, but if it's a high deductible plan and they have the EMEC and VSP wellness, will it let you do both to pay for it?
Yes, yes. If they have both benefits, then you can use both of those to coordinate. Now, understand when you're doing the deductible, you, like in my example where my usual customary was $200, you can't collect $200 towards their deductible. Remember, you can only collect $150 for that 92004. So that's why it's so critical. You have to know your fee schedules, which is equivalent to your allowed amounts. What you've contracted that says this is the allowed amount I'm going to accept and nothing more. So your 150 is what you're going to collect towards their deductible. So yes, you can use their essential medical eye care and their signature plan together to go towards that deductible. So it helps the patient eat up their deductible.
Perfect. We have another question, Dr. Webb, from Aaron, and I'm also going to share a survey QR code right now for everybody, just to 5 questions. So as we're wrapping up, we can all do that. So Aaron, go ahead.
Yeah, I just had a question. This seems to be kind of confusing when it comes to the diabetic screening. You mentioned the well vision exam auth and the essential eye. Is that do we have to bill that to their medical primary, or can we just send it to VSP directly because is it a benefit in itself, or does it need to be billed secondary?
So are you talking about the retinal screening for diabetics?
Yeah, like when you went over the 92250 and then you build it with the well vision and then the second essential eye, you had those split screens.
Yes.
Do they have to be sent to primary medical if we take it, or is that just kind of like a benefit you can use on its own?
Now, it can be a benefit that you use on its own if the patient doesn't have any pathology. You can't bill it to primary medical. So in that case, remember, it's a screen. If you're doing a retinal screening and they're diabetic and there's no pathology, well, then you have to bill it VSP as primary, and it's all just under routine vision for VSP. Unless your state recognizes because that patient's just diabetic, then it becomes a medical exam. In Arkansas, just being diabetic doesn't meet the qualifications. That has to have some type of retinopathy, some type of pathology to qualify as a medical exam here. So, but assuming that, again, there's no pathology, well, then now that's why essential medical eye care actually has a built-in plan for your diabetic patients for the screening, even when there's no pathology. So that's really a cool thing. But that's why you do the 92250 with a 52 modifier. That 52 modifier says there's no pathology. So again, if there's no pathology and there's no way to build a major medical because there's no medical to bill, there's no medical diagnosis to bill, it's going to get rejected, of course, then you bill VSP primary for the well vision and for the essential medical eye care to get reimbursed for the exam and the screening when they're diabetic.
Okay.
But that's
But if it's
assuming there's no
medical-
pathology.
Okay, but if there's pathology, you have to build a major medical first?
That's correct. So if
Okay.
there's the eligibility of billing medical, then medical's always primary, essential medical eye care then becomes secondary always.
Gotcha.
I do not see any more questions, but does anybody have anything else for Dr. Webb, as we're just at time? No? All right.
Great
Well,
job,
thank you.
Dr. Webb. Great
Yeah,
job.
thank you again, Dr. Webb. Obviously, if anybody needs the materials or has questions, please reach out to the team. We will make sure you all have them. I think they were all sent out, but let us know and we'll make sure and send them over if you need it.
Thank you, guys. This is such a great honor. You have to understand, you are my colleagues. Like I said, you are ambassadors like me, so it is a great honor for me to teach you guys anything. You guys teach me so much, and so again, it's such an honor to be before you guys because I have enormous respect for what you do and who you are. So thank you.
Great job. Thank you. Thank you.
Thank you.
All righty. We done?
Yeah, you're good, Dr. Bass. We'll see y'all later.
See ya. Bye.